The Disability Participation and Consultation Network's response to the state's draft report on the United Nations Convention on the Rights of Persons with Disabilities, April 2021. This submission was commissioned by Inclusion Ireland on behalf of the Disability Participation and Consultation Network, or DPCN. Inclusion Ireland is the organising member of the DPCN. There are 4 grant-funded members. As I am, the Disability Federation of Ireland, Mental Health Reform, and the DPO Coalition, a coalition of national organisations of disabled persons. Individuals and other disability organisations are part of a wider group of non-funded members. This submission reflects the commentary from a series of consultation meetings organised by the DPCN. The consultation notes were analysed by ACE Communication Ireland. This submission was prepared by ACE Communication in collaboration with the 4 grant-funded members of the DPCN. This submission is part of a longer report on the consultations. This report is available on the DPCN Facebook page and Inclusion Ireland website. Introduction. The Disability Participation and Consultation Network, or DPCN, was recently established in December 2020 to ensure that persons with disabilities are actively engaged and directly consulted in the development of legislation and policies. The DPCN was initiated and is being funded by the Department of Children, Equality, Disability, Integration and Youth. It is in the early stages of being established and network structures have yet to be developed. The first task of the DPCN was to respond to the state's draft report on the implementation of the United Nations Convention on the Rights of Persons with Disabilities, or UNCRPD. This submission reflects the views expressed during the online consultation organised by the DPCN. Overall, there was strong support for the consultation process, and participants engaged enthusiastically, expressing a broad range of opinions and ideas. The consultation focused on 12 articles of the CRPD. There was some confusion about the role of the DPCN and persons with disabilities in the development of the state's draft report and in the process for responding to it. As the DPCN was very recently established, it had little time to get off the ground before this consultation and submission had to be undertaken. This is the first time some participants have been involved in such a process, and it was a valuable learning experience. However, the conclusion highlights the need for more information, awareness, and education on treaty processes. So comments on the content of the state's draft report. The state's draft report is weak and does not accurately reflect disabilities in Ireland. It does not adequately address many of the key issues for persons with disabilities or acknowledge the failings of the state in relation to these. The state's draft report does not cover the barriers and obstacles that persons with disabilities encounter in their everyday lives and their interactions with the state. There is a lack of data around persons with disabilities, which hinders both advocacy and policy making. The state's draft report lists developments and actions which have not actually happened or been fully enacted. While the state's draft report provides an impressive list of programs, policies, and strategies, it does not discuss the implementation of these, the problems they have encountered, or how successful they have been. The state's draft report lacks concrete targets, timelines, measurable actions, or outcomes. The state's draft report focuses too much on the future and on what may be achieved down the road. It reinforces the notion of persons with disabilities as receivers of care rather than contributors to society. So, urgent actions required. Persons with disabilities and disabled persons organisations, or DPOs, are the heart of the Convention. This is not reflected in the state's draft report. A differentiation must be made between DPOs and non-DPOs. DPOs must be recognised and prioritised. The state must commit to the adequate funding of DPOs to support the participation and representation of persons with disabilities. There was broad agreement that Ireland has developed a number of laws, policies, and strategies that could have a positive impact on the lives of persons with disabilities. However, the state's draft report fails to address key concerns in relation to implementation, transparency, and accountability. Persons with disabilities requested to be involved in the design and management of consultation processes going forward and in the writing of responses and submissions so their true experiences are captured and fully appreciated. Equality. Persons with disabilities report that they experience barriers in many different aspects of their lives. They feel there is a constant need to fight for equal treatment. The comments below arose primarily as part of the discussions on CRPD Articles 6, 7, 12, 13, and 19. The state's draft report does not clearly identify the actions the government is undertaking to promote equality. The state's draft report does not reflect the lack of choice that persons with disabilities have in the services and supports they receive. It does not acknowledge the lack of equity in how resources are organised and distributed, for example, across geographic regions and disability types. The state's draft report fails to highlight the delays that children with disabilities and their families experience in accessing time-critical medical or therapy services such as ENT, MRIs, surgeries, psychological supports, speech or language therapy, or occupational therapy. Some participants in the consultation reported waiting times of up to 4 years. The state's draft report does not acknowledge that this lack of access means that children can have enduring needs into adulthood and less opportunities in life. The state's draft report does not reflect gaps in training for staff in mainstream public and community services so they can understand and respond to the needs of persons with disabilities. It does not say how it will ensure that the public sector duty is implemented so staff are aware of their obligations to treat people equally. The state's draft report does not say how the state will collect more comprehensive data on persons with disabilities to accurately plan for future needs. The state's draft report does not commit to the provision of information and education for persons with disabilities around rights, the law, and access to justice. The state's draft report does not highlight the very low numbers of people currently in receipt of a personalised budget. It does not propose a wider implementation of personalised budgets to ensure access for as many people as possible. The state's draft report fails to recognise that persons with disabilities were more significantly impacted than others during the COVID-19 pandemic. It does not prioritise the resumption of day and other support services or the provision of clear timelines in relation to access to these vital services. Respected as experts with experience. Persons with disabilities must be recognised as experts with living experience of disability. The comments below arose primarily as part of the discussions on CRPD Articles 6, 9, 12, 25, and 29. The state's draft report does not reflect the delays in fully enacting the Assisted Decision-Making Capacity Act 2015. It does not communicate clearly how progress will be made going forward. The state's draft report does not commit to adequate funding for the Decision Support Service or to starting the operation of the service as soon as possible. The proposed date for commencement is 2022. The state's draft report does not reflect the need for health and social services to be person-centred rather than system-centred. This would give people back control and the freedom to make their own decisions. The state's draft report does not prioritise the need for persons with disabilities to be represented on patient advocacy groups, steering groups, forums, and decision-making bodies, so their living experience can be heard. The state's draft report does not recognise the frustration expressed by participants about being on consultative committees, but having little impact or influence on decision-making processes. The state's draft report does not emphasise the need for all complaint systems to be user-friendly and accessible. The cost of living with a disability. Financial pressures are a barrier to persons with disabilities participating fully in society. National and international evidence highlights the additional costs of living with a disability. The comments below arose primarily as part of the discussions on CRPD Articles 6, 7, 19, 25, 27, and 28. The state's draft report does not reflect the additional personal and social costs of living with a disability. It does not acknowledge the fact that persons with disabilities are being pushed into poverty. The state's draft report fails to highlight that the standard disability allowance payment and other disability-related welfare payments are inadequate to meet basic needs and support independent living. Participants suggested that the disability allowance should be brought up to the level of the pandemic unemployment payment. The state's draft report does not recognise the impact of disability on the family unit. Families of children with disabilities can have a lower income because of the cost of living with a disability. One or more family members may be required to give up their job, change their job, or change their working hours in order to provide long-term care to a person with a disability. Persons with disabilities often have to pay for private health insurance or pay privately for therapies, treatments, medical equipment, aids and appliances, and personal assistance hours. The state's draft report does not acknowledge the additional financial pressure this puts on individuals and families. The state's draft report does not identify the need to simplify the process of applying for financial supports. This would reduce the administrative burden on persons with disabilities and their families. The state's draft report does not recognise that the current system of means testing for certain benefits needs to change. Means tests should disregard any income used to cover costs associated with having a disability. The state's draft report does not commit to changing the system for medical cards. Participants said that all persons with a disability should automatically get a medical card. It should not have to be renewed every year. The state's draft report does not concede that grants and allowances are not keeping pace with increasing costs, and there are often shortfalls. This excludes people from availing of them. Grants and allowances should provide enough financial support for persons with disabilities to live an independent life. Accessibility and mobility. Inaccessible environments cause stress, anxiety, vulnerability, embarrassment, isolation, and segregation for persons with disabilities. Lack of access impacts many aspects of life, including education, employment, leisure, and social activities. The comments below arose primarily as part of the discussions on CRPD Articles 9, 19, 20, and 27. The state's draft report does not reflect the lack of consistency in the implementation of universal design. It does not say how laws and policies will ensure that spaces, places, services, and information are designed with accessibility in mind from the outset. The state's draft report is not clear on enforcement mechanisms and statutory powers in relation to accessible environments and information. Participants emphasised the need for accountability and transparency nationally and locally, and sanctions for those that break the law. The state's draft report fails to highlight the fact that many public buildings are not fully accessible. This includes government buildings, public services, college buildings, healthcare settings, and leisure facilities. The state's draft report does not recognise that Part M of the building regulations is inadequate and needs to be revised. The state's draft report does not mention the lack of accessible toilets and, in particular, changing places facilities in most towns and cities. It does not commit to supporting initiatives such as changing places, which provides additional equipment such as a hoist and an adult-sized changing bench. The state's draft report lacks detail on how public transport and infrastructure will be reviewed to ensure full accessibility in both urban and rural locations. The state's draft report does not explain how the role of access officers will be monitored and coordinated. It does not say how access officers will be trained to support persons with a range of different disabilities. The state's draft report does not commit to a single transport information website that is developed according to universal design principles. The state's draft report does not say how regulations in relation to the size of accessible parking spaces will be enforced. The state's draft report does not commit to ensuring that all public information is provided in a range of different accessible formats. The state's draft report does not emphasize the need for all public service websites to comply with the Standards for Web Accessibility, or W3C. It does not say if and how assistive technologies will be used to support access to public websites. Education. The comments below arose primarily as part of the discussions on CRPD Article 24. The state's draft report is not clear on how the education system can be made more inclusive. The state's draft report does not acknowledge the need to review the Education for Persons with Special Education Needs Act 2004, or EPSEN, or to propose a plan for its consistent implementation nationally. Children with disabilities must have the chance to go to mainstream school if they wish. The state's draft report does not explain how the policies of schools will be monitored to ensure that primary and secondary schools cannot refuse to enroll a child with a disability. The state's draft report does not address the issues of progressing disability services. The rollout varies from one geographic region to another. Some areas are very understaffed. There is no commitment to the establishment of full multidisciplinary teams in all regions. The state's draft report does not identify the low numbers of adults with disabilities at third level. It does not promote the need for creative thinking and engagement to facilitate those with disabilities to be part of this community. It does not address the limited number of modules available to adults with disabilities at third level. The state's draft report fails to acknowledge the existing gaps in career guidance supports for teenagers and adults with disabilities. It does not provide data on the supports currently available in schools and third-level institutions. The absence of these supports reflects the low expectations of young persons with disabilities. The state's draft report does not commit to the provision of increased mental health supports in the third-level system. Employment. The comments below arose primarily as part of the discussions on CRPD Articles 6, 19, 27, and 28. The state's draft report does not analyse how essential policies link together to ensure that persons with disabilities can maximize their employment opportunities. For example, accessibility, personal assistance, transport, social protection, education, and employment. The state's draft report does not address the poverty trap that persons with disabilities face when they try to take up employment. It does not acknowledge the need for a review of the rules in relation to work and social welfare payments. Persons with disabilities should not be financially punished if they take up work. The state's draft report must emphasize the importance of all workers being paid at least the minimum wage. Persons with disabilities should not be expected to work voluntarily in a work experience capacity or on CE schemes on an ongoing basis. The state's draft report should highlight the positive impact a person with a disability can have in the workplace and promote the provision of reasonable accommodations. The state's draft report does not acknowledge the need for more investment in employment services for persons with disabilities. The state's draft report does not encourage the government to increase the percentage of public sector jobs which are allocated to persons with disabilities. There should be more roles for persons with disabilities in the civil service, state agencies, public sector organisations, and local authorities. Health and well-being. The comments below arose primarily as part of the discussions on CRPD Articles 6, 20, and 25. The state's draft report does not acknowledge the extremely long waiting times for treatments and services, in particular, waiting times for physiotherapy, psychology, and occupational therapy. The state's draft report fails to highlight the difficulties that persons with disabilities can experience when they try to get an appointment with a GP. There are no GPs in some areas, and persons with disabilities may need to travel long distances to access a service. The state's draft report does not recognise the need for increased spending on mental health, so a wider range of supports and therapies can be offered. Treatments need to be extended beyond medication and should include, for instance, counselling, occupational therapy, or music therapy. The state's draft report does not reflect the challenges that persons with disabilities can face when trying to access mainstream health services. The state's draft report does not acknowledge the lack of accessible and easy to read information in many healthcare settings. Independence and community living. To live independently, persons with disabilities need accessible environments and information, adequate assistance hours, appropriate housing, and transport. The comments below arose primarily as part of the discussions on CRPD, Articles 9, 19, 20, and 28. The state's draft report does not reflect the difficulties that persons with disabilities have in accessing suitable housing in the community. Creative models of housing are needed that can respond to individual needs. The state's draft report fails to recognise the lack of interagency working in the provision of housing. This means a person with a disability may get a house, but not the supports they need to live there. The state's draft report does not prioritise the development of a housing and disability strategy. There should be a recommendation that local authorities have an allocation of social housing for persons with disabilities. The state's draft report does not identify the policy gap in addressing the needs of persons with disabilities living at home and depending on their families. The state's draft report does not reflect the need for advocacy services to support persons with disabilities to live independent lives and make their own decisions. The state's draft report does not recognise that personal assistance or PA hours are inadequately funded. The importance of assistance hours to independent living must be recognised. There should be transparent criteria, assessment guidelines, and allocation procedure for PA services. There is an absence of statistics in the state's draft report in relation to the provision of PA supports. The state's draft report does not highlight the need for more home help services. The state's draft report does not acknowledge the very limited access to out-of-hours services. The state's draft report does not recognise the lack of safe, accessible community facilities to support the needs and interests of persons with different disabilities. For example, accessible parks and playgrounds, dog-free parks, allotments, accessible parking spaces, accessible bathrooms, and changing facilities. Taking part in political and public life. The comments below arose primarily as part of the discussions on CRPD Article 29. The state's draft report fails to recognise the need to support persons with disabilities to stand for election. It lacks detail on models and policies to facilitate this. For example, a fund to help with campaign costs or the provisions of reasonable accommodation. The state's draft report does not emphasise the importance of political parties providing campaign materials in accessible formats so persons with disabilities can make an informed choice when voting. The state's draft report should say how the government will be proactive in encouraging persons with disabilities to vote. There should be information and education on the voting process. Accessibility supports for voting should be in place across the country.